Welcome back. Let's learn about how cardiac muscle contracts. So, when we're talking about cardiac muscle contracting, we're talking about a heartbeat. And if you've ever put your head on somebody's chest, you've heard a lub dub pause, lub dub pause, lub dub pause. And so, what that is letting you know is that the heart is contracting, relaxing, and it's relaxing for longer than it's contracting. And that's because the heart has to contract 24/7, 365, as opposed to other muscles where you can go work out in the gym and then you can relax those muscles for 2 days before you have to work them out again. So when we talk about part of the heart contracting, we use the word systole. So we can talk about atrial contraction would be atrial systole, and ventricular contraction would be ventricular systole. And when you're listening to the heart, that first sound, that lub, that represents ventricular systole. So what is happening then is blood is leaving the ventricle. So we have blood entering the pulmonary artery, specifically the pulmonary trunk, then the two pulmonary arteries, as well as the aorta. And in order for that to happen, you are hearing the sounds of the valves opening, the pulmonary valve in front and the aortic valve behind it are opening. And meanwhile, the larger tricuspid valve and mitral valve are closed. Now, when the ventricle relaxes, we use the term diastole. And in fact, the dean of my medical school called his house diastole because it's where he went to relax in the evenings. So during ventricular diastole, this is the dub sound, the second sound that you are hearing. So at this point in time, while the ventricles were contracting, blood was still pouring into the upper chambers, into the atria. So when the ventricle relaxes, the valves between the atria and the ventricle are going to open, and that blood is going to pour in from above. So the blood is going to be leaving the atrium and entering the ventricle. So that tricuspid and mitral valve are going to be opening, and the pulmonary valve and the the aortic valve are going to close. So what makes the heart muscles contract are unique cells within the heart itself that have characteristics of both cardiac muscle and nervous characteristics as well. And they form what we call the conduction system of the heart. Now, there's a big conglomeration of them right in the upper part of the right atrium next to the opening of the superior vena cava. And this grouping is known as the sinoatrial node, which you may see abbreviated elsewhere as the SA node. But, for me, for tests, you have to know the term. You can't use the abbreviation. And so this is going to send impulses across not only the right atrium, but internodal pathways going all the way across the left atrium. So both atrium are going to contract at the same time, sending blood downward towards the tricuspid and mitral valves. Now, right above the tricuspid valve, there is another grouping of the cells known as the atrioventricular node, which then picks up and generates a new impulse. Okay? And this is because there is an electrical isolation between the atria and the ventricle. So you do have to generate a new impulse. In this course, we don't learn why that is, but there just is. So the atrioventricular node starts a new impulse, which will travel down in the muscle, the septum that separates the right ventricle from the left ventricle. So it travels in one pathway originally called the bundle of His, named after a dude. I know it's written H-I-S like his, but he pronounced his name like hiss, like a snake hisses. Okay. Partway down that septum, that bundle branches, and on the right side, you would get what's called the right bundle branch, and on the left side, you would get the left bundle branch. And these branches go all the way down to the point at the bottom of the heart, known as the apex of the heart. And then they travel up, and it's just not one line going up like you see here, but it actually goes up in 3D around the entire ventricles. So you've got a lot of branches going up from the bundle branches. And then extending off of the bundle branches, we have all these little branches. And notice we have these little branches, and they go into the papillary muscles as well to cause them to contract. And all of these little branches are called Purkinje fibers. And so what is going to happen is after the atria contract, it's going to relax. Then the atrioventricular node picks up the impulse and it travels down to the apex. And then the muscles at the apex are going to start contracting there. So ventricular systole starts down here at the apex. So it's going to start at the bottom and work its way upward, thereby pushing blood upward. And so when it does that, it actually closes the tricuspid and mitral valves first. Then, as it continues to contract, it will then open the pulmonary and aortic valve, and then blood will exit the ventricles. So this gives us our cardiac cycle. So we start with the entire heart relaxed. Then we're going to have atrial contraction, both chambers above atrial systole. Then the atrial will relax, and then the ventricles will have systole, and then the ventricles will have diastole, and then everything will be in diastole. And then we'll start again with atrial systole while the ventricles are still in diastole, then atrial diastole, then ventricular systole, and then everything is in it, diastole again. So that's the cardiac cycle. Now we can change our heart rate besides just with the conduction system of the heart. We have influences on it from outside the heart. And here's the thing about that conduction system of the heart, it doesn't need any input from anywhere else. It decides on its own if it wants to make the heart beat. You can have the best open heart surgery in the world, but if that conduction system doesn't want to do it, the heart won't start beating. You can give all the medicine you want. You can shock it all you want. And if it doesn't want to generate impulses, it won't. But if it is generating impulses, we have ways to control the heart rate as well as the oomph of the contractility from outside the heart. And the first influences come from the brain. There's a cardiac control center in the medulla oblongata, that lowest part of the brain stem, where there is autonomic nervous system control, specifically the parasympathetic stimulation through what's called the vagus nerve will decrease activity on both the sinoatrial and atrioventricular node, which will decrease the heart rate. Whereas sympathetic stimulation will increase activity of both of those nodes, thereby increasing the heart rate. Another place where we have external control is through the adrenal medulla, where we have sympathetic nervous system stimulation can release catecholamines, as well as exercise can release catecholamines. So epinephrine and norepinephrine then can increase the heart rate. So when the heart contracts and sends blood out, we can feel it peripherally in our pulses, in our wrists, our radial pulses, in our neck, our carotid pulses, behind our knee, our popliteal, and our groin, our femoral pulses, and our ankle pulses. And the pulse is due to that artery, the elasticity expanding and then contracting back down, that recoil of the arterial wall due to that surge of blood. And so the normal resting pulse for adults is anywhere between 60 and 80 beats per minute. So we usually say around 72 beats a minute. So this shows the medulla oblongata up here with the parasympathetic innervation going to both the SA node and the AV node to decrease heart rate. And then this is the sympathetic innervation, which goes not only to the sino-atrio and atrioventricular node, but also goes directly to ventricular muscle itself, because not only does the sympathetic nervous system increase heart rate, but it can increase contractility. So it's like the difference between doing arm curls like this and doing arm curls like this, where you're putting some effort behind it, so we can increase that contractility. All right, so that generates a blood pressure, okay? That contractility, that outward force of blood against the blood pressure wall. So it's going to depend on blood flow, how much volume we have coming out. If it's just a trickle, there's not much blood flow. You're not going to get much blood pressure. But you know, if you turn the faucet on full, there's a lot of pressure. But it also has to do with the resistance. If you got hardening of the arteries, you're going to have more resistance. Whereas if you have elasticity, you're not going to have the resistance. The pressure will be lower. And also realize the pressure is going to fall the further you are from the heart. Okay, so the aorta is going to have the highest pressure, and then by the time we're down in the capillaries, it's really fallen, and the venules and the vena cava have practically nothing, because as we talked about, we need skeletal muscle activity to push that back to the heart. So when we talk about a blood pressure, we give one number. We kind of do it like a fraction with a number and a dividing line over another number. And the top number represents the pressure during ventricular systole, whereas the bottom number represents the pressure during ventricular diastole. Okay, so a normal blood pressure for an adult would be a systolic blood pressure of under 120 and a diastolic pressure of under 80. So a blood pressure of 118 over 70 or under 120 over 80 would be normal. So 118 over 70 would be perfect, would be a normal blood pressure. High blood pressure is defined as a systolic blood pressure of 140 and above, or a diastolic pressure of 90 and above. So if your blood pressure is 140 over 70, because that systolic is 140, you have high blood pressure. And the word for high blood pressure is hypertension. Or if your blood pressure is 130 over 90, you also have high blood pressure. Okay. And high blood pressure used to be a thing that you didn't used to get until your 40s, 50s, or 60s. But now we know, because of dietary and lifestyle changes, at least 10% of American college students have high blood pressure. So go to your campus first aid place or go to your local pharmacy and get your free blood pressure checks. And if your blood pressures are high, go to your primary care person, whether it's a physician or whether it's a nurse practitioner or whoever it is. Because if you have elevated blood pressure, you are having organ damage without you realizing it. Okay, and I'll be talking about this in a later video. And the average person has 10 years of damage before they decide to get treatment. So don't let that be you. And here's something else, folks. You need to learn this. You've got to know the numbers for normal, and you've got to know the numbers for high blood pressure. All right, with that, we are done with this section. Come on back when I'm actually going to go through the cardiac cycle in a little bit more detail so you can understand it clearly. I'll see you soon. Thank you for all your hard work.